So welcome and thanks for being here. Today we're talking about drug policy in America and the moral issues of how this medical, spiritual issue is dealt with criminally, and how we might change our understanding and do a better job of caring for people who are hurting. And our drug policy is not doing a very good job of that. We want to kind of talk about that today. So today we're delighted to have Reverend Al Sharp. He's a founder and executive director of Clergy for a New Drug Policy. He's our special guest today. If you have questions for him during the talk today, go ahead and start putting your questions in the Q&A, and those will queue up. And when we get later in the webinar, we'll have a chance to review those. So go ahead and ask your questions. Even if you have them now, you can go ahead and put them in there, and we'll try to get to as many of them as we can. I also want to welcome my co-host, Tim Mcmahon King. He's the author of this excellent book that I highly recommend. He's going to be the keynote speaker at our upcoming Addiction and Faith Conference in October. He'll be introducing our topic today, co-hosting us, and moderating our Q&A time. So, Tim, thanks for being here today. I'm Pastor Ed Treat. I'm a Lutheran pastor, a person in long-term recovery, recovering addict. I'm founder of this Center of Addiction and Faith. We are a brand new organization. Before I begin today, I'd like to tell you a little bit about myself and what it is we're trying to do with this Center of Addiction and Faith. I spent my youth as a prodigal son, living wild like a wild animal until I landed in treatment age 27, 34 years ago. Was treated for drug addiction, alcoholism. I went back to school and got my undergraduate degree in journalism. I went off to the seminary, was ordained in 1995. And so I've been an ordained pastor for 25 years. And throughout all of my ministry, I have been really kind of frustrated and saddened that the church has such a little and such a poor understanding of addiction, and does so little to address it, which seems kind of ironic because it is a disease that requires a spiritual element for healing, and the church seems so clueless. And I just think about how much more the church could be doing. That's been my passion over the years. Well, 2 years ago, we held a conference in Minneapolis, and we wanted to, I and some others wanted to try to inspire and educate some spiritual leaders about this problem and teach them a few things. And so we put out an invitation, we put together some great speakers. We thought we'd get maybe 40, 50 folks from the area to come. And we were absolutely blown away when 200 people, we had to cut it off at 200. And they came from 32 states and 12 different denominations. We weren't even marketing really much for this event. So we were so blown away by that. And so when this happened again for our second conference last year, or in 2019, I felt a call that this needed to be a ministry for the broader church. And along with the support of some really excellent people, including the two folks I have on this webinar today, we're working to try to educate the church and the world about this problem and how we can better deal with it. So we started this ministry. The Center of Addiction and Faith is a brand new 501(c)(3), and we're trying to help raise awareness and educate the world. Currently, we offer this webinar once a month. We have our annual conference. We have a new robust website full of great information and resources. We have a new downloadable app. Go to your app store and download it. It's free. It's full of great resources, tons of features. Go to your app store and look for Center of Addiction and Faith. And then beginning on February 1st, we'll be rolling out our new podcast series, Stories of Addiction and Graves. And they're personal stories of clergy who got caught up in addiction and by the grace of God found a new life in recovery. And so we share those stories. They're quite powerful. I'm excited about that. We're doing also an addiction awareness training event coming up in November. And I'll be talking about that at the end of the webinar. So if you're interested in doing that with your parish, there's so much more we want to do as we grow. So I hope you will join this effort. We need partners in this ministry. I can't do it alone, but I do know a lot of people doing a little can make a big difference, and we can accomplish great things. So please visit our website, addictionandfaith.com. Join our effort by putting your name in and becoming a supporter. It costs you nothing just to put your name in. You'll get on our email list, but it will add to the momentum of our effort by growing our partnership list. Your prayers are welcome. And of course, if you want to donate, I did leave a paying job to do this, and I'm not being paid now, so I would like to get paid some at some point. So if you want to donate, we'd certainly welcome your support that way. We welcome anything you have to offer. We're looking for volunteers too. So if you feel passionate about this, let me know. So enough of that. I want to turn this over now to my co-host and dear friend, Timothy Mcmahon King, to set up this conversation for us today, get us underway, and he will also introduce our guest today. So Tim, hand it over to you. Take it away. Thank you.
Thanks, Ed. And yes, as a board member now of the Center of Addiction and Faith, I too echo Ed's sentiment. We do want to get him paid. So any support there that you can personally or through your church or ministry is certainly appreciated. And one other note with today's conversation, one thing that we've wanted to do is to build this kind of conversation off of some of our previous webinars, in particular looking at addiction and race. Because you can't have a conversation about public policy and drugs in the United States in particular and not deal with some issues of race. Because as you can see from early 1880s, early opium drug laws, specifically targeting Chinese immigrants, to laws around opioids and heroin usage, particularly targeting Black communities, marijuana laws targeting Hispanic communities, and then what we saw in the 1980s with the rise of the crack epidemic, racial justice and justice around addiction and recovery are all melded together. So if you haven't had a chance to look at some of those webinars, we encourage you to take a look at them as well, because that really builds towards the discussion we're having today.
Those aren't on the web. Sorry, Tim. Those aren't on the website yet, but they are on the app. So you can get all the previous webinars on the app right now. They will get on the website, but they're not there yet.
And so one thing that I wanted to draw out today, as I've been talking with a lot of different groups about my own experience becoming addicted to opioids through my time in the hospital, through an extended illness there, I wrote on the front of my book cover was always this line, 130 people die a day from opioids. One of them could have been me. And one of the tough things with that is even as the book was being prepared for publication, those numbers became out of date. At the time that those numbers were accurate, we were at about 72,000 overdoses a year. Our current numbers are at 82,000 overdoses for the last 12-month period we have available data. And so this pandemic has certainly worsened things, and we're seeing these numbers continue to skyrocket. But one of the things, as I've talked to people, I realized was a misunderstanding. So I was sent home from the hospital on heavy levels of hydromorphone, which is an opioid about 10 times stronger than heroin, and also on fentanyl, which is one of the drugs that has been driving the overdose crisis, which is anywhere from 50 to 100 times stronger than heroin. And as I've talked with people, a lot of folks were assuming that my life was in the balance because I was home on those drugs and experiencing the early stages of addiction where my usage was compulsive and it was much higher than I was being prescribed. But in fact, the point that I want to go back and make a little bit stronger now is what threatened my life was not the fact that I was on those drugs, because even at the time, when you have it dosed from a doctor, when you've got it consistent, when it's a clean supply, my risk of overdose was actually very, very, very low. What would have been a threat to my life was if my doctor had immediately cut me off when he had discovered that I was using off script and had pushed me to a place where I felt the need to find a supply on the streets. Because what is killing people at such a high rate is not just opioids, it's illicit opioids. It's the opioids where they don't know how much they're taking, or it might be mixed with another substance. What is the big threat and the big danger is prohibition and a punitive approach that focuses on incarceration and instead of treatment. And as a Christian, one of the things that I believe is at the core of how the world works and how people change is that the most powerful force for change in someone's life is grace, is the opportunity to change, not the punishment that someone receives. And so that's why it's exciting to have Al here today because he has been on the forefront of this conversation, especially among a lot of mainline churches and denominations, helping people rethink their position to drug policy and to move away from this mindset that to decriminalize or to focus on treatment is somehow just this permissive ethic, as opposed to a compassionate ethic that responds to the numbers and the research of what we know of how people actually move into recovery, how we can actually reduce overdoses, and how we can reduce harm. And one of the things too is, as we hear these numbers about overdose rates, we hear 82,000 accidental overdoses in the last 12-month period we have data for. I hear that term accidental and I worry that it's misunderstood far too often. People hear accident and they think about something that no one could have foreseen, or they think about people not being careful enough to preserve their own lives. And I actually think we need to stop using that term accidental overdose, because, if you have an intersection where there's an occasional accident, sure, you call it an accident. But if there's an intersection or a stretch of road where you keep seeing accident after accident after accident occur, you stop calling it an accident and you start saying there's something negligent happening, because there's something wrong with how that system is set up if we keep seeing people crashing. And I think what we have today is no longer an accidental overdose crisis, but one of negligence, because we know the systems we have set up aren't just inadequate, but oftentimes making things worse. There was one study done in Baltimore following thousands of IV drug users. They were trying to figure out what program they were implementing that was most effective to help people move into recovery. And when the data came back, the only thing they could say with confidence was that those who had been sent to prison, those who had been engaged in the criminal justice system, were more likely to overdose or continue using than those who weren't. Right now, we have a criminal punishment system that isn't set up to restore people. It isn't set up for health. It isn't set up for the flourishing of communities. It's set up as a punitive punishment system that is often making things worse. And so Reverend Al, through this work, previously he'd been Protestants for the Common Good, leading the charge in the state of Illinois for a wide variety of issues that matter to us all as Christians, as followers of Jesus, and has taken this time in these past few years to specifically focus in on what can we do to reform our criminal justice system. This isn't an issue where we don't know what can work. We've seen other countries implement effective policies to reduce overdose rates and then also dramatically reduce usage rates, even with a much more compassionate and person-centered focus. So excited to hear from Reverend Al today about these foundations of advocacy and what that can look like in all of our churches and institutions. Al, take it away.
That's a great setup, Tim. I appreciate it. And I'll give some specifics that draw upon your particular examples. So the title of the talk, I'm taking very literally, Addiction and Advocacy, the Role of the Church. And I've got to say at the outset, I have what might be considered a Don Quixote complex. Addiction, advocacy, can we ever really get at the heart of addiction? Do most churches care about advocacy? Can we bring the two together? As Ed said, in mainline Protestant churches, you don't hear a lot about advocacy. I've visited many congregations across the country, and it's been my sad experience, and a baffling one, that you can go into almost any mainline church and not see a hint that addiction exists, even though addiction is so close to us in our families, our friends, and even in ourselves. And that's why I was so excited 2 years ago to learn about the Center of Faith and Addiction. Went to the first conference in Minneapolis and really feel privileged to support it in any way that I can. The center will help us stop ignoring a reality that we have too long failed to acknowledge and which we have an obligation as congregations to respond to. Now, advocacy, taking a stand and raising our voices on issues that affect us as individuals and communities. Many churches don't do advocacy. Why? First of all, it's hard. I've often felt the problem is not that clergy lack courage, but because they don't know where to start, how to structure the conversation, how to choose priorities, develop strategies for being heard. They don't teach that in most seminaries, and they should. There are a lot of good models in churches around the country to draw upon, and secular organizations with information on drug use and addiction. The Drug Policy Alliance, Students for a Sensible Drug Policy, the Marijuana Policy Project, and many others, and I hope you'll get to know them. Now, for some congregations, advocacy is too controversial. When I was in divinity school, I worshiped in a church near the campus. It was during a time of intense public discussions about healthcare in the Clinton administration, just when they were getting started. And I suggested to my own pastor that she invite experts on a Sunday after the sermon to debate the pros and cons of universal coverage. And she turned to me with a pained look at her eye and she said, "Al, you're scaring me to death." So it's not surprising that not many churches talk about advocacy. As the name implies, Clergy for a New Drug Policy does reach out to clergy and congregations, and we seek a health, a healing, not punishment response to the reality of drugs. Our advocacy goal is to end the tragic war on drugs, which over the past 50 years has failed to reduce the availability of drugs, even as it has wrecked countless human lives at a cost of over $1 trillion, not a billion, $1 trillion. Now, I assume most of you, as pastors and members of congregations, have read Michelle Alexander's superb book, The New Jim Crow, which made the case about how devastating the war on drugs has been to people of color. Now, advocacy assumes an agenda. What I'm hoping you will consider this morning are the urgent need to change our drug laws, to advance what is called harm reduction, helping people limit the harm of their drug use rather than just insisting on abstinence. Catholics, please notice. Examples include administering naloxone, which revives people on the brink of overdose death, providing clean needles and syringes, and medically assisted treatment also, that's the third, like buprenorphine and methadone to assist in withdrawal. And yes, safe consumption sites. In such facilities, individuals can bring their drugs and administer them under medical supervision. And I'll say more about these later. But I will say if those existed, the overdose deaths that Tim was talking about in his introduction wouldn't have happened in nearly the same numbers. People could have gone into a safe environment and they wouldn't have died in many cases. Now, let me be clear. None of this is intended to encourage the use of drugs. What we are saying is that drugs are a reality. Our focus should be not on drug use, but on drug abuse. Prohibition, as Tim said, is not the answer. The regulation, which can take many forms, and education, the right kind of education, are the answers. And if I could recommend one source of information on regulation and education, it would be a book with the wonderful title, Regulating Vice, by James Leitzel of the University of Chicago. He defines vices as pleasures that can become harmful, certainly drug use, but also gambling, pornography, and other potentially dangerous behaviors. Now, in our battle against the drug war, Clergy for a New Drug Policy also opposes mandatory minimum sentences, civil asset forfeiture, private prisons, cash bail, and collateral consequences of drug convictions. You know, I was visiting with the chief Episcopal figure in Vermont when I was campaigning for legal marijuana there. And he didn't realize this. He didn't realize that I remember him expressing surprise. He said, he didn't realize that under the current law, drug offenses can carry with them the denial of public housing, food stamps, income assistance, and even education grants. Now, these may not seem directly related to addiction, but they can make addiction seem like the rational option if you're one step away from living on the street. Now, how does this agenda connect to addiction? Again, our mission focuses on healing, not punishment. The voices fueling the war on drugs call for punishment for individuals using drugs, including those who are addicted, to be put in jail, to be locked up. This is simply wrong, especially theologically. This is not what Jesus did. He did not say to the woman caught in adultery, go down to the local jailhouse and turn yourself in, and maybe I'll talk to you later. No, he said, go and sin no more. He did not lecture the Samaritan woman at the well on all she had done wrong in her life. He spoke to her about the living water. Indeed, everyone who drinks of this water will never be thirsty again. Not a bad message for those drowning in alcohol. Jesus healed without redemption, without condemnation. He held people accountable, but he did not blame them. Now, punishment, the underlying premise of the war on drugs, has caused an unspeakable amount of human misery. And I could spend the rest of this webinar giving you story after story of lives ruined by the drug war. But I want us to go deeper. I want us to think about punishment in relation to the problem it's intended to address. To do this, we need to consider for a moment the nature of addiction and its causes. Let's join the perpetual debate about whether addiction is a disease or a choice. Federal researchers who have made amazing advances in neurophysiology are passionate advocates for what might be called the disease model. They talk about changes that become etched into neural pathways, hijack the brain, and never go away, hence the notion of chronic disease. Philosophers and psychologists are more likely to argue that addiction is, at some level, a matter of choice, even as they recognize the overwhelming difficulties of achieving recovery in so many cases. The reality, of course, is more complex. I like what Princeton Theological Seminary faculty member Sonia Waters, who also with Tim will be the next keynote speaker at your conference, what she tells us. It's not just one cause that creates addiction, but a dynamic tangle of vulnerabilities that catches the individuals in the net of addictive behavior. Or the author and former addict Maya Salavitz, who accepts the concept of disease, but sees addiction most fundamentally as a learning disorder. She has written that addiction doesn't happen to people because they come across a particular chemical, learned, and it has a history rooted in their individual and social and cultural development. If addiction is a disease, it should be obvious why punishment doesn't make sense. When was the last time you heard that someone had been arrested for pancreatic cancer or Alzheimer's? Perhaps punishment in the form of arrest and jail might be the appropriate response to drug use, if not addiction, since use can lead to addiction. But how can that be the right response when, as we know, the great majority of those who use drugs never end up with a substance abuse disorder? And about 70% who do get to this point recover on their own. So we know that punishment does not make sense if drug use is a disease. So let's turn to the choice model. If drug use is a choice, we can be held responsible for our actions. We have moral agency. Some people consider use of certain drugs to be immoral. Under laws mandated by the war on drugs, such use is illegal. So violations of the law must be punished and lock them up. What's wrong with punishment? One practical difficulty is that law enforcement generally lumps drug use and addiction together. Even if jail or prison might deter a drug user from a future use, generally, incidentally, is not the case. Do we really think that jail or prison is where those living with addiction belong? Second, let's be clear. Most of us who live relatively comfortable lives, who aren't scapegoated in the way that Rene Girard talks about so much, are oblivious to the violence, yes, violence of jails and prisons, the violence that they inflict upon body and soul. Locking someone in a cage and giving him or her a number, not a name, even for a short period of time, those are acts of violence. Someone once said poverty is violence in slow motion, and so is incarceration. Now here's the overriding point. When it comes to healing addiction and stopping drug use, punishment, for the most part, I will say absolutely does not work. When punishment is our first resort, we are making misguided assumptions about human behavior and how people change. Addiction forces to address this question acutely. I submit that nurture, not punishment, is the better answer. Someday I want to debate James Dobson if he's still making his point. Punishment is not the better answer. Obscenely long sentences given us by the war on drugs do not deter drug use. Some would argue for the value of drug courts, though. These are special courts for drug offenders. Judges have the options of offering treatment and expungement of charges if individuals succeed in their treatment programs. Drug courts generally serve only the easiest to help. They don't permit relapse, though relapse is almost always a part of recovery, and oppose medically assisted treatment, the use of methadone and other drugs to assist with withdrawal. Not surprising that a spirit of punishment drives our criminal justice system. But consider this. This is true. I'm facing this in Illinois. Country prosecutors in Illinois right now are opposing changes to our drug laws on the grounds that we have to arrest people in order to help them, to steer them to treatment. Imagine, we need to separate people from their families, their jobs, put them in jail, and possibly brand them with a criminal record because forced incarceration is the only alternative. And I haven't studied this, I will, but I doubt that there is a lot of this approach to forced incarceration going on in white suburban neighborhoods. Where does that leave us? Here's where advocacy comes in. We have an extraordinary opportunity right now, at this very moment, to speak out simultaneously with a dual message. Treating drug use and addiction as a crime is wrong, indeed immoral. And second, that drug treatment is the right, indeed the compassionate response. Take the position as clergy and congregations that all low-level drug use should be decriminalized, and simultaneously, anyone who seeks it should be steered to treatment. Let me define criminalization. It's not the same as legalization. Under decriminalization, drug use is still a civil offense, like a traffic ticket. Selling drugs remains illegal. This isn't pie in the sky. It's already happened in one state, in Oregon, this past November. Ballot Measure 110, the Decriminalization and Addiction Treatment Initiative, passed by a 57 to 43% margin. Low-level drug use and possession is now legal in Illinois, and upon implementation, treatment will be offered in any of 10 regional health centers to all who accept the referral. This will be paid for by higher than expected revenues from cannabis legalization. Let me repeat that. Drug users will not be arrested. Treatment will be available to all who need and request it under this law. It can be argued that we already have decriminalization all around us. Think about it. We took this step almost 20 years ago, back in the mid-'80s, when we first began to practice what I mentioned as harm reduction. We took a pastor to begin this movement in the United States, the Reverend Edwin Sanders, senior servant of Metropolitan Interdenominational Church in Nashville, Tennessee, and started offering clean needles to addicts in the vacant lot across from his church. He didn't want people dying from HIV/AIDS due to dirty needles. How can you do this, Pastor? Some of his congregation asked. I can't save souls if people are dead, he said. Once you decide to help someone rather than arrest them, you're practicing harm reduction, and all the rest is easy. Although drug decriminalization is so far limited to Oregon, it will become a movement. Trust me, I've been doing this for 10 years. Started with medical marijuana. We've now legalized cannabis in 15 states, medical in 36 states. Advocates for decriminalization in New York and California are already taking up the cause. The clergy among you can advocate openly for this. Actually easier for you to support than the legalization of cannabis. And here's why. In recent years, I've traveled to at least 10 states on behalf of cannabis. I sought help in person from many clergy, and I was always grateful when they were prepared to discuss this with their congregations. But I wasn't surprised when most of them did not. Even though probably 65% of the congregations supported legalization, that still left 35% who felt that marijuana use is wrong. Who wants to take on 35% of your congregation? Clergy were willing to allow me to use their names, their personal addresses, but not the names of their church. I respected this position, and I was grateful for their individual support. Here's the point. Decriminalization is different. The law does not condone use. You can argue that drug use is wrong and still support this law. There is a civil sanction. But decriminalization does keep society from labeling someone as a criminal. It does says that branding is wrong in that way. In religious terms, it's immoral. I believe that clergy can and should seek congregational support on positions that are morally the right thing to do. My own personal test is that if I could preach on something as a morally right position, that's my criterion. I can imagine standing in front of a congregation and saying that it is immoral to put individuals in jail, burden them with a criminal record solely because they possess or use low-level drug amounts. Now, assuming we agree that those in churches should advocate for decriminalization, still, what does this have to do with addiction? That's actually easy. And maybe the most important part of this message, and why Center for Addiction and Faith will be so important. Criminalizing drug use and addiction not only ruins people's lives by turning them over to the criminal justice system, it also stigmatizes addiction. It gives all of us an excuse for those who, all of those an excuse to excuse those who are struggling to walk on the other side of the road. It gives us an excuse to ignore them. Recall the parable of the Good Samaritan. We have an excuse, which mainly registered subconsciously, to pass by those in the ditch. We can, if only through our silence on addiction, tell them that they are not welcome in our churches. Have we in our congregations ever thought of doing just the opposite? Finding a way to make it clear that those struggling with substance abuse are in fact welcome among us? The analogies are obvious. My church has a sign on its front lawn, big sign saying in bold letters, Black Lives Matter. Churches declare they're welcome to all gender orientations with rainbow logos. Couldn't we find a symbol or a logo that offers the same invitation to those struggling with substance and addictive behaviors? Why not? There are other forms of potential advocacy as well. A lot depends on where you're located. I've mentioned harm reduction. There are neighborhoods where it makes sense for pastors and staff to be trained on how to administer naloxone. In these same neighborhoods, church leadership could invite mobile units to provide harm reduction services like clean needles and basic health supplies to show up in the church parking lot at least once a week. Is this advocacy? On such controversial matters, there's a fine line between advocacy and service. Simply providing the service becomes an act of advocacy. Reverend Sanders was doing more than providing clean needles when he appeared in the parking lot beside his church 40 years ago. The same thing is true with educational programming in churches. Invite some speakers to your church to talk about addiction. Ask them to speak about harm reduction. It will not be long before cities across the country are considering whether to permit what we've talked about as safe consumption sites. Right now, there's only one in North America. It's located in Vancouver, Canada, and I took a clergy group to visit it. It saves lives and offers the possibility of treatment. Over 60 exist in Europe, throughout Europe, and also in Australia. Versions of such sites are becoming commonplace in Canada. In this country, Philadelphia is close. The city's approved it, but stayed by the district attorney in the third region in that area. I'm proud that, and that will be overruled. I'm proud that Clergy for a New Drug Policy and a host of other religious voices signed on to an amicus brief in that case. Again, on issues such as this, education becomes advocacy. Let me close with one final essential question. Advocacy in churches is difficult and often unpopular. Why should churches do it on addiction or anything else? Why advocacy in churches? Let me offer 3 reasons. The first seems obvious, but too often we don't articulate it. My friends, we can't avoid advocacy. We say nothing on the issues of the day, certainly those of deepest Christian concern. We are endorsing the status quo, and the status quo is a very political position. Violence is consent. The only question is what kind of advocates we're going to be. A second reason for advocacy is that charity, giving to the food pantry or our local neighborhood club, is insufficient. Charity can help us alleviate the conditions we want to challenge, poverty, poor education, housing, many more, but it can never address the cause. And the third reason has to do with the very nature of love. At the end of the day, at its core, our faith is about nothing other than love. But without action, what is love? One cannot love in the abstract. One loves in relationship. We can't love our neighbor without caring what happens to our neighbor. Advocacy is a form of caring. Bringing up the issues of drugs and addiction in our congregations won't be easy. But perhaps at some point, we have to ask ourselves what kind of churches and pastors we want to be. If we are concerned about congregation members who may walk out. It may even be that more individuals will be attracted to boldness and variety than to passivity and blandness. Let me close with brief stories about two men. One, a law enforcement officer, the second, a lawyer, both of whom I deeply admire. First is Neil Franklin, who for 34 years worked with the Maryland State Police and Baltimore Police Department, where he rose to the position of commander. One day, he was furiously trying to arrest a group involved in a drug deal. Things got terribly out of hand. A fire broke out in the building where the drug bust was going down, and a friend of Neil's was killed. This was a turning point. All at once, Neil saw clearly what he'd been wrestling with for a long time, that in fighting the war on drugs, he was doing far more harm than good. He changed his direction. For the next 10 years, he headed a group called, until recently, LEAP, Law Enforcement Against Drug Prohibition. Their bedrock premise is that the major response to drug use and addiction is fundamentally a health, not a criminal one. The lawyer is a lovely man named Mark Ostler, professor at St. Thomas School of Law in St. Paul, Minnesota, renowned expert and advocate on clemency and pardons for the wrongly convicted, those serving excessive sentences. As someone who grew up in a church environment, he could recite at least a few biblical passages, and he stayed with it from childhood. For many years, Mark Ostler was a federal prosecutor in Detroit. His job was to send those accused of dealing or even possessing crack cocaine to prison, sometimes for life. Under the law, those dealing crack, usually African Americans, at that time, were 100 times more likely to be convicted than those, mostly whites, using powdered cocaine. One day, Ostler remembered Jesus saying to the Pharisees, "We're about to stone the woman caught in adultery. Let him who was without sin cast the first stone." I realized, he recalls, I was the guy with the rock. What are we doing in our congregations? If we are silent about addiction, are we not holding stones in our hands, even if we do not throw them? Through an excess of caution, are we not failing to do what we reasonably could to turn back the spirit of punishment abroad in the land that has allowed the war on drugs to become the longest war in our nation's history? We can end this war. If even police, if even lawyers can see the light and step forward, surely as clergy, we can too. Decriminalizing low-level possession and use of all drugs is a good place to start. Delighted to answer questions today, and hope you'll contact me into the future.
Thank you so much, Al. And already have a few requests in the chat to see if we can get a written copy of your talk.
Sure.
So that'll be, I'm
Glad
sure
to
we
do
can
it.
coordinate that. And so folks, please feel free to use the Q&A piece you'll see that at the bottom of your screen, or hop into the chat function to ask some questions. Al, one thing wanted to note quickly and then turn this into a question for you is, watching the inauguration yesterday had a great reference to St. Augustine and that encouragement that if we are going to be together as a people, to find those common objects of love. And I think that is an underlying theme of your talk today, is that we need to find those common objects of love, of human flourishing, to start there and allow that to influence our public policy.
Yeah.
And the other thing that we can pull from Augustine too is ideas of imperfectionism.
Yes.
And the reality that a community can seek justice, but because of our own imperfection, that pursuit of justice can sometimes cause injustice.
Yes.
And that is so much of what you have highlighted today. And I was wondering if you could talk a little bit about Portugal. And I know you also took a trip of clergy there, and how they were able to reverse a lot of these negative trends by upending, getting back to what are our common objects of love, and admitting that we can, in the name of justice, sometimes perpetuate injustice. And then I'll grab some more of these questions from the chat.
No, it's a great example. So even people in the field still don't know what Portugal has done. They decided in 2001, it's 20 years ago now, to decriminalize all drugs. They had a very serious problem when they changed the leadership, their monarchy, to a different form of government. Drug use was very widespread on the streets, even in Portugal. And rather than going to an attitude of repression, the prime minister created a commission, a high-level commission of academics and practitioners to decide what to do, and they decided to decriminalize all drugs. And here's what that means. It means that there is what is called a dissuasion commission. And police, incidentally, are delighted with this. If police find someone who has less than a trafficking amount of drugs in their possession, in other words, if they're not drug dealers, they refer those individuals to this commission, or dissuasion commission, which consists of a lawyer, a doctor, and a social worker. They conduct an interview. If they make the judgment that the person doesn't need treatment, there may be a small fine, community service, or a warning, whatever. But if the person does need treatment, and this is where Portugal is so different than the United States, they can refer somebody to the treatment. They have treatment beds available. The main message is that it's working. Drug use is down for almost all age groups, certainly hasn't increased for youth. And you could argue that drug use in some form should increase, especially for older folks that, or they have aches and pains and ailments where actual marijuana, certainly cannabis, can be helpful. Drug use has not increased. Crime has not increased. Drug use is lower than corresponding countries in Europe. People say, well, yeah, well, the United States is so different. We can't do that here. Well, you can do it somewhere. You can do it in the state of New Jersey. You can do it in the city of New York. You can take an area and make it a pilot. And I think someday we will. But it's a great example, and it shows a real live alternative that we should take very seriously.
Thanks, Al. And had a question come in particular from Wilhelmina.
Let me give you an image also. I'm sorry. I went to look at the treatment centers, and I remember going to one area where there was a van. It wasn't a treatment center. Treatment centers are one thing. Vans that provide medically assisted treatment, methadone, buprenorphine, are another thing. I talked a little bit about that in my comment. I went with a person who is involved in the Ministry of Health, for example, stood by one of these vans. When the van arrived, suddenly, and it was near an open field, but also near a lot of office buildings, people began to walk across those fields and down the street to get their treatment, if you will. They took their treatments, they went back to their jobs. They were living a semblance of normal life. Under repression, under prohibition, that never would have happened. I will never forget that image of a field being increasingly populated by people walking to a van to get their treatment and going back to work.
Yeah. And that was one story we've talked about, is William Wilberforce.
Yes.
Known as, this pioneer for fighting to end the transatlantic slave trade in Great Britain, the entire time was heavily addicted to opium. And this idea that somehow if someone's using a drug that makes them moral degenerates, or that they can't have deep, meaningful pursuits. I'm trying to forget his name. If we have any Catholics participating, you might know. A saint in the Catholic Church who had been in China and was deeply addicted to opium, was never able to quit. And even in the midst of that, he was martyred for his faith. And that just goes to show that this idea that it's just weak-willed people is completely inaccurate. You can have those who are deeply engaged in meaningful work and struggling with addiction at the same time. We've got a question from Wilhelmina Barker, specifically asking, seems like this would be a threat to the private prison industry. And yes, it will be. Would love for you to touch on that. And Al, if you also feel comfortable, one thing too is, while I believe we've got an administration that's going to take the public health side of this much more seriously, we also have an administration that doesn't all have the greatest track record as far as looking at how President Biden responded in the 80s and 90s to these issues.
Yeah.
So could you touch on both the private prison industry and also some of what you might hope to see under a Biden administration?
Yeah, if you do go to I would like to plug Clergy for New Drug Policy for a minute. We have a website. We've blogged on all these issues for the last 5 years. And if you go to the website and go to About Us, and then go to Newsletter Archives, you'll see these blogs, and I mentioned that in relation to private prisons because I did blog on private prisons. Oh, there's so much to say. I mean, they're bad. The Obama administration, you may recall, and federal contracts with private prisons, and they're a volatile industry. There are only 2 or 3 leaders, and they can go out of business if they don't get contracts. So the Obama administration was very threatening to them. The Trump administration brought back private prisons, restored those contracts, and the leaders of private prisons literally lobbied for harsh drug penalties on the grounds that their prison population would go down if you did the kinds of things they're talking about. So private prisons in relation to what we're talking about are the wrong answer. Even when they were banned by the Obama administration, there's another point to make that under Trump, when they came back, we don't realize that 62% of all the housing, if you want to use a kind word, of immigrants on the border were managed by the private prison industry. That was a great resurgence of their financial viability. Oh, I'm not a fan.
Yeah.
And the second question was about Biden in the 20s. Yeah, I think Biden is the right person for the job. I'm deeply admiring. This isn't a campaign for Biden, but it is in fact true that in the 80s he supported, and certainly in the 90s, he supported a lot of the war on drugs legislation. He certainly supported mandatory minimum sentencing. He supported Clinton's crime bill. So he doesn't have an unblemished record. What we can say is that, like most of us, there's always the chance of redemption. There's always the possibility of change. So, I'm disappointed. I'll talk about legalization of cannabis if anybody's interested. He's still on the decriminalization fence on that. And the problem didn't really play up the distinction. The problem with decriminalization as opposed to legalization is that the black market stays in place. The market is still driven underground. Probably the most important reason for legalization of marijuana is it allows you to regulate it. You know what you're getting, and it's a complicated discussion, but that's the main thing. And
Coors and Anheuser-Busch aren't starting gang wars.
Yeah, exactly.
Which that was what was happening under prohibition of alcohol.
Yeah.
The biggest driving factor of those cartels is our policy.
John Hari's book, Chasing the Scream, was a real eye-opener on the impacts of what the drug war policy is doing in terms of criminal enterprise. Yeah.
And a few other notes. We do have folks in the chat feature working to connect with each other. That is a great use. Like, we encourage that. Please do that. And Carol Patterson, it looks like in particular, is in the St. Paul, Minneapolis area and is saying would love to connect with others who are looking for resources. And so please do keep using that in that way. Sorry if I miss anybody. There are a lot of chats, but wanted to highlight that. And do have another question from Cheryl Bunsma asking about drug courts. Do you see that as a stepping stone? You had mentioned it a little bit. I know a lot of people are highly critical of them as keeping the criminalization framework in place. But if you could talk about that, and then I'll just give you 2 questions so that you can answer them both. Another is
you may be overestimating my capacity.
I'll keep track if you need to come back to it. Okay. Is reluctance of insurance companies to cover residential treatment and probably other cutting edge treatments that are effective but not mainstream yet.
Okay. Well, on the drug courts, the Drug Policy Alliance, which is a fine group, is pretty much opposed to drug courts. And I tried to give the reason why. There are 3 quick things that I know, and I'll mention them here. The first is that, and this may not be true of all drug courts, presumably institutions can improve, but certainly there's a pattern of skimming, responding only to the easiest cases to address. The second is that many, again, maybe all of them, aren't understanding about the importance in almost not the inevitability, but the likelihood of relapse as part of recovery. So you're in a court system and the judge prescribes the treatment, but if you relapse, then you go to jail. So that can be a difficulty. And the third thing is that they, I think, do not permit what we've been talking about as medically assisted treatment. Medically assisted treatment in the forms that I mentioned it are drugs used at a lower level to help with withdrawal, and those are an important part of recovery. And if you're going to be sanctioned if you don't, quote recover in treatment, and one of the major ways of helping with the treatment isn't allowed, it's kind of a double whammy. So those are the arguments I know against drug courts. I know people that I respect who swear by them and see lives has changed, and I'm sure that can happen. But I guess I would say the bottom line for me is if treatment's available in this country for only about 10% of the people that need it, let's expand treatment and let's steer people into treatment stops, even apart from requiring making it an alternative to punishment. That's what's going to happen in Oregon. They aren't guilty until they redeem themselves through drug courts. Treatment is being made available. That's the way I think ultimately we should go. And on the insurance coverage, that's beyond my pay grade. What I do know, I just don't know the answer to that. But what I do know, which is so obviously overlooked, is that Obamacare, for the first time, covered substance abuse treatment, addiction treatment. That was a massive change. Whether Obamacare got to the level of coverage for what our questioner is asking about, I'm not quite sure. But let's not ignore, as the Trump administration did, the fact that treatment for drug use and addiction is essential, and Obamacare covered it, and it should be part of any coverage we have going forward.
Mm.
Excellent. And did have some questions about additional resources for starting ministries and inside the church. And I am just telling people to contact you directly, Ed, since
Okay.
you and Drew are doing some
Yeah.
trainings on that in particular.
Yeah.
We do.
So
We have an
and-
upcoming. I'll mention that at the end here. I'll talk about it.
Do people know how to contact me? I welcome that. And COVID wasn't hard for me because I'm doing some writing, but I'm prepared to travel and meet people where they are and speak, and I love to do that.
Is it all right if I just drop your email address in the chat box there, Al?
Please do.
All right. So that's Reverend Al Sharp at gmail.com. Great resource. I think most folks probably, if you've signed up for these webinars, probably have Ed or my emails address. Have another in the Q&A box here. This is again from Wilhelmina. And I particularly enjoy this. If the definition perception of addiction was broadened to the use of any mind or mood altering substance activity, for example, shopping, sex, exercising, would the church and people be more open to discussing a different, more compassionate approach? What happened to Jesus came for the sick in the way the church acts in society? As the face of a drug user / addict change from white, female, middle, upper classes in society, the church more open to a compassionate approach? And so, yeah, just to jump in here,
Sure.
This was something that highlighted in my research was that, 100 years ago, the face of opium addiction in America was white upper middle class women, because doctors were prescribing opium to women at very high rates. And so much of how we view addiction is how we view who is addicted. And so when we expand that understanding and realize that, this is happening in a lot of different places, it becomes a lot harder to create that us versus them, that it's your problem out there, not our problem. And that's certainly going to be a lot more true with the pandemic, with people being at home. This was one of our first webinars, was dealing with how the pandemic will affect addiction rates. Somebody who used to start drinking after work and isn't going to the office anymore might be starting now in the early afternoon. And that slowly becomes a problem. Addiction is not just a radical, life upending moment, it often has years where it's fairly controlled or seemingly controlled, even while having negative consequences. But sorry, Al, I jumped in. I appreciated that comment and jumped in there.
Yeah.
Anything else that you'd like to talk about as far as how we view who is the
Yeah, well,
addicted person?
let me refer to what you and I have talked about and what your book says, which is that at some level we're all addicted. By being human beings, we're all addicted. The great commandment, first commandment of the Ten Commandments, you shall have no other God before you. Uh, well, and the great commandment, you shall love the Lord your God with all your heart, soul, and mind. Well, we're all in some way diverted from a full and complete love of God. And in that sense, we're all addicted to things around us. I think that's a very important concept. I will say that the kind of addiction and substance abuse use that we're talking about today, it's certainly a difference in kind. But what all this adds up to me is that if you take the trouble to think about addiction and understand it, it's a great resource for pastors and churches about how to think about themselves and about how to preach. How do people change? Look at addiction and what we know about how people change. We're all addicted. Doesn't that just say something theologically? And how do you begin to parse that and look at it more closely? So for me, real addiction is the dark side of the gospel. Freedom from addiction is the freedom that God talked about. If that doesn't give you room to talk about addiction in churches, I don't know what does.
Well, that's a great spot to end. I need to wind up. We're down to 1 minute left. I've got a couple of announcements I want to do, but Al, thank you. What a great segue there. It is, and that's been my passion to say, I've watched pastors go out into the field, go through seminary with, and get no training on this whatsoever. And I just think it's so pervasive. How can that be the case, that pastors who are out in the world trying to care for people that don't have an understanding of this issue that impacts every single life there is? I mean, it just seems like it should be a basic understanding, the dynamics of it and how to deal with it. I need to wind us up here. We're at 12 noon. I have just a couple of short announcements before we close. We try to keep this webinar on time. I'm going to share with you a couple of announcements here. First of all, our conference. Let me see, is that coming up okay, Tim? Can you see that on your page, Tim?
It's there.
I think,
okay.
Yeah.
Then this is the conference that's coming up. It was scheduled for February this year, but because of COVID, we moved it to October. We think we'll be safe by then. And hopefully you'll all feel like it's time to get out and be with other people. So we're hoping to have a good turnout. We're also going to offer much of this conference on webinar, but it's never quite the same as being there in person. Tim will be one of our featured keynote speakers, along with Reverend Sonia Waters, who is a professor at Princeton and has written the book Addiction and Pastoral Care. Tim's book is Addiction Nation, and it is what every congregation should read and go through as a book study to get oriented to this issue and prepare their just to know how to think about it, because it's about all of us and how addiction affects the whole. What it says it right there at the bottom of this book. What the opioid crisis reveals about us. There's a lot of layers to this whole thing. Anyway, registration is open. Lots of great resources there. Go to our conference site and you'll see what's available there. That's coming up in October. Our next webinar next month, we're trying to set that up. We don't have it confirmed yet, but we're looking to do a follow-up to this webinar today. The topic is addiction and harm reduction. We'll have some people from the Harm Reduction Coalition to talk a little bit more about the work they're doing and why we should know about it and understand it. As referenced, we also have an addiction ministry leadership and team training coming up. There is a fee for that class. It is quite intensive. It's being led by Drew Brooks and the Faith Partners organization, and they have 20 years of ministry experience helping congregations design addiction ministry that fits in their setting. So it's helping congregations build a team, a sustainable ministry that fits with their context, and there's part of that is a readiness assessment. There are scholarships available if your congregation needs help doing this, but just contact me, Pastor ed@addictionandfaith.com, and I will give you the details. But it is coming up in February, and it is about a year-long process in total. It's a 6-month process of training. It's quite extensive. So let me know if you're interested. There's space limited there. On February 1st, we're launching our first podcast, our first podcast show, My Story of Addiction and Grace. We're going to hear stories of pastors who've struggled with addiction and found new life through recovery. And these stories are sacred and inspirational. And then finally, somebody in the Q&A or the chat page asked, how do I find out about these other webinars? Well, they're on our app and they're free. This one will be on our app as well, and will be on our website soon. I'm just one person trying to do all of this, so I can't kind of spread thin. But we do have it on our app. It's free. Go to either your Apple Store or your Google Store, App Store. Look for Center of Addiction and Faith and download it. It's got a lot of good stuff already on there, but it's going to grow and be even more of a great resource. Lots of new meetings starting up, some just for clergy. If you're clergy and you're interested or struggling with any form of addiction, these 12-step groups are they are safe and they are anonymous, and you can do a phone-in meeting or a Zoom meeting. And then there are other groups that aren't just for clergy, but they are people from mainline churches who are able to talk about their struggle and their relationship with the church. So that's all on the app. You can look at that. And if you want to help us do this work and expand it, we could sure use your help. There's a donation page on our website. Please have a look at that. Any final thoughts before we close it up, you guys?
We're good.
Oh, I do. I have one final thought. As I was watching the chat page, I was just thrilled with the conversations that were going on and the interest that there is out there on this topic. And the whole time I kept thinking, boy, it would be sure nice to have just a regular Zoom meeting with all these folks who have an interest in this topic to share ideas. So if anybody listening to this would like to help facilitate a meeting like that, maybe quarterly or whatnot, to invite people interested in this topic just to come and share what's going on, I would love to have that conversation. Again, I could use some help doing that. So let me know if you're interested in facilitating a discussion on the topic of addiction. We're done at 12:05. God bless you. Go in peace. Serve the Lord.